Hello, everyone, and welcome to the Sex and Wellness Podcast with Dr. Mary. I'm excited today to talk about our cycles, different products, what's considered normal and not normal, and kind of figuring out ways to find the perfect menstrual cup, disc, or tampons, or whatever works for you. So today I'll give you a guideline on how to understand which product is right for you. And also to get an idea of what's normal, in our tracking of our cycle. So to start off, one of the most important things that I can say is to track your cycle. And what I mean by that is you want to get an idea of what is going on. How regular are your periods? Are they 21 days? Are they 35 days? Are there somewhere in between? Right? And so those are obviously shorter periods and longer periods, but generally most people are going to be around 28-day cycle. But again, that's give or take. It's really what's normal for you. But if you are tracking, just kind of keeping an eye on what your symptoms are, right? And so it's really interesting. The more that information we gather about our period, it can really kind of change how you think about your body and different activities and things like that, right? I'll give you an example. There's a whole trend right now going on about, working out with your cycle. And I think that's great. If it works for people, that's amazing. But, some people might find it helpful, some people may not. But the reason it's helpful is because people are gauging based on when different hormones are elevated and using that to kind of guide them to their workouts, especially when estrogen is elevated. But what I would say is going with your cycle, understanding, hey, what are those symptoms? If I'm really fatigued around my menstrual cycle, when I start my period, maybe I'm just going to do lighter workouts, right? Because I'm already exhausted. You might just want to do gentle movements, some gentle stretching. And then as you recover from your menstrual cycle, you can start noticing that your symptoms are, maybe you're less tired, you have more energy. And so it's really respecting those fluctuation in your hormones and understanding that, hey, it's okay if you don't want to push yourself while you're having your period. And there may be other days where you feel like you can. Overall, the idea is to start just paying attention to your body because we're not really taught any of these things, right? And so the more you can kind of hone in, typically around, days 15 or 16, I get more cramping, or this is when I notice more hip pain, or this is when I have more pain with sex, right? And so you're just tracking. You're tracking how you're feeling, your energy, any symptoms that you're having. And as you start tracking it more and more, you'll start to get an idea of a pattern of your body. And then when things are kind of out of sync, and then that's when you can address that with your doctor and say, hey, especially if you're around, perimenopause can start as early as the late 30s. And basically, that's the time before menopause, and that can last around up to 8-ish years or so. But if we're not getting an idea of our cycle and symptoms, right, and what we know is normal and not normal, then it's going to be harder to kind of figure out what phase we're in, right? And so I also think it gets a bit more complicated when people have IUDs because they're not necessarily getting their period, especially if it's the ones with hormones in it. But if you are tracking your cycle, you're just going to learn a ton from it, and you'll be surprised what you notice. And again, you're just observing it. You're not doing anything crazy. You're just noticing, oh, I feel more energy on this day. I feel I have maybe more back pain on this day, or I notice that, I'll give you an example. So recently, I had typically after I've had chemotherapy, I actually had 2 periods a month for like 12 months, and it was debilitating. And this is really when I started diving more into this and thinking, okay, well, what shifted? What's going on? My body obviously there were a ton of chemicals that went into my body, but you're going into that fight or flight mode because your body There's a lot of stress around cancer, the medications, people letting you down, people showing up for you. There's just a lot going on there. But what I found is that when I regulated my blood sugar, so maybe I didn't eat, a million cupcakes before bed. I mean, I'm just giving you an example. Or I, instead of getting super stressed about something that is technically not a big deal, I do some breath work to kind of calm my nervous system so I don't go into that fight or flight, which can spike cortisol, which we know that blood sugar increase can sometimes cause an increase of endometriosis symptoms. So for me, it's significant pelvic pain and cramping. And so that's really how you'll get an idea of, your body and what works. But especially if you're dealing with chronic hip pain, chronic back pain, low back pain, or pelvic pain, this is a must because you may find a huge correlation. And sometimes it can be due to the cycle being dysregulated because the uterus has a ligament that connects to the sacrum. So that's the lowest part of your spine. And you can imagine if you're having really heavy periods, that kind of pressure is going to kind of pull downward. And sometimes that can increase some of that back pain. And there's a variety of reasons why you can have back pain during your period. But if you notice that it increases during that time and then is gone after, we know, okay, something's going on around the menstrual cycle. And this is something we need to address with understanding, well, why is this happening? A lot of times it's a lot of lifestyle changes. Unfortunately, anytime or a majority of the time, birth control is given when there's any period abnormalities. And I'm not against birth control, but what I think is sometimes it's used as a crutch versus kind of looking at, well, what actually is going on? And, we've talked about how different hormones can be helpful for endometriosis in previous podcasts. But the whole point is to kind of get an overall big picture of what's going on and getting an idea of, hey, do I need hormones for that? Do I need birth control to regulate it? Or can I use some of the tips like we talked about in the endometriosis podcast or in the PCOS podcast, where a lot of times you can start making some lifestyle changes that can make a big difference. And again, this isn't all encompassing. I just cannot emphasize enough how important it is to track your cycle. And it doesn't mean you need to track it all the time. Just track it enough where you can start noticing, oh, okay, I typically notice more fatigue on this day. I have more hip pain on this day. And then you can kind of gauge that with your healthcare provider, especially the amount of times that endometriosis is missed because it's chronic hip pain. It doesn't really make sense, or chronic back pain, pelvic pain, just a variety of things. And it's still not super well understood, which is unfortunate, but then you can give that information. So for instance, if, hey, you're going to an orthopedist for your hip pain, but you mentioned, hey, my hip pain is actually worse on X day of my cycle. I don't know if that will change what they think about it, but it's really important to mention it and make sure that they are considering that in figuring out what is going on, because we've normalized pain and dysfunction during our cycle. The reality is we should not have a ton of pain and we should not be bleeding through tons and tons of super plus tampons throughout our period, right? The thing that's important is that, yes, you may have some minor cramping during your period, but if you are your first day completely incapacitated, in excruciating pain, you can't get out of bed, you're just completely exhausted, that is not normal. We have normalized it because, you see things on TV like, oh, I'm on my period, and the movies from like the 90s where people are eating like a ton of ice cream and, chocolate and all these things, which could actually be making the cramping worse. Sorry, my nose keeps itching. But it can potentially be making those symptoms worse. And so you can also gauge that too. And, oh, hey, it was the holidays and my period after that was really bad. Actually, that's me talking. But yeah, so then I know, okay, chill out on the stress, chill out on eating a bunch of those cookies and start focusing on what am I putting on my body and how do I feel afterwards. But yeah, so you'll get a ton of information from that. So we're going to jump into different period products, and there's people have a ton of questions about these. And so I'm just going to kind of talk about each different type and how you can kind of gauge what works for you, right? So the number one thing I would say is there's a huge trend right now, which I'm very thankful for, and using cotton or organic cotton pads and tampons. This is really important because if we're putting chemicals in our vagina, if you think about all your periods that you're having, you're repeatedly exposing that tissue to chemicals. We don't know, it's very hard to say what causes issues overall or cancers or diseases, who knows? But the point is thinking about what you're putting in your body, and you can look at the ingredients. Some of the original people that made tampons, they're starting to come up with more organic, but I would look at those ingredients and you'll be shocked. Sometimes there's bleach, there's a variety of different things. And so what you can do is they're at a bunch of different grocery stores, at least in Austin. You can kind of find non-toxic tampons and kind of see which ones are there. They're actually about the same price I've seen, or at least the ones I've seen, as the ones that don't have 100% cotton. But another thing to think about with the tampons is if you're having chronic pH issues, right? So what is pH, right? So we've talked about how the vagina is supposed to be, generally speaking, more acidic. And so sometimes when the acidity goes to more of a neutral or basic, that's when we're more susceptible to infections, itching, yeast infections, UTIs, bacterial vaginosis, right? So we want to stay in that acidic environment. If we're continuously using things that might be irritating that, such as not extreme, but chemicals that are going intravaginally, you can see how that could potentially irritate the vaginal environment versus using 100% cotton to help absorb the blood. But so that's really important to even just look at that. And I just think it's insane how, it's 2024 and now we're starting to kind of notice these things. And you just think about all of the tampons you've used or pads or whatever. And, hey, if you don't have access to anything else or they're there, whatever, I'm not trying to say don't use these tampons, use these, whatever works for you. I just want you to be aware and then you make those decisions. So I don't like to shame people or judge or whatever. I just want people to have information and then they can, kind of make those decisions for themselves. So like, for instance, I actually don't use tampons as much anymore. I've switched to cups, but we'll talk about that in a second. But, if I'm needing a tampon and I go to a place and it's not the kind of tampons that I typically use, I'm going to use it because I don't want to bleed everywhere, right? So you can just gauge if you're having a lot of pH issues, vaginal dryness, pain with sex, irritation at the opening of the vagina, then it may be something to kind of just observe. Same thing with pads, right? So if you have vulvodynia or pain at the vaginal opening or any skin irritation at the opening of the vagina, sometimes you'll feel like burning. Sometimes it will feel just really dry. Please look at it, lay down, take a mirror and look at the tissue. Generally speaking, you might not know what is it supposed to look like. If it looks really red and irritated, that is not, there's something going on with that tissue, and that could be a pH issue. It could be some type of irritation from a soap or underwear or a decrease in estrogen. Maybe the tampons, different condoms, who knows, right? So that is a big thing, especially with people with vulvodynia. So basically, vulvodynia is a blanket kind of diagnosis for pain around the vulva. And when we start looking at people with chronic pain around that area, we want to just look at everything. Even, that goes for cotton underwear. That goes for, hey, try to just wash off the vulva with soap and water, or gentle soap, or just water, and spread the labia, and you can spray that area or flush water in there. I would try to avoid using a loofah that can trap bacteria. I try to avoid using a washcloth just because it can really be abrasive and irritate that area. And you also just want to be careful about not increasing bacteria into there. But if you love using wash rags, then I would just use a new wash rag every time. But just notice, if you're fine using the wash rags and you don't have any symptoms, then you're fine, But I just trying to get you to kind of think about, oh, that makes sense. Or why didn't I think of that? I get that a lot in the clinic, actually. People will say, well, a lot of times, why does nobody talk about this? Or why didn't I think of that? That makes total sense. And so it's really interesting. The more you listen to your body, you'll find that it's trying to tell you something. And it's just, I don't know, it's just pretty neat. So then you can kind of be your own detective. I don't know why I said detective, but and figuring out, hey, is it the tampon's irritating your vagina? Is it not? Do you notice a change in vaginal irritation around your period? Is it because of the tampon or pad? Who knows? But just looking at those things, and sometimes the pads can actually irritate the area as well, but also just making sure you're changing those a few times a day just to help reduce the bacteria. But generally speaking, going back to the tampons, if you're blowing through tampons and you are just every hour using a Super Plus and you just keep bleeding, that reminds me of that song, Leona Lewis, keep bleeding. Anyways, if you keep bleeding through that, we need to get an idea of what's going on there. I don't want you to accept that every 4 weeks you have 5 days of feeling like shit. So let's multiply that. So 5 times 12, that's 60 days. That's 2 months a year. 2 months a year, you're feeling like shit. We've normalized it because that's just what women do. But what if you knew there was another option, right? So that's just, 60 days in 1 year. And then say you're menstruating I'll just say, okay, so from 15 to 45, so 30 years roughly, give or take, right? So 30 times 2 months, right? And so then you're looking at, gosh, my math is really bad, but you get what I'm saying. That should not be acceptable, but we've accepted it as a society because we just accepted that, oh, we have a uterus, so we're going to have pain and we're going to be out for a certain period of time. And again, if you've tried all of these things or you've listened to the other podcasts, like I said, endometriosis podcast and the one on PCOS are going to be super important for you to kind of get some lifestyle ideas and to understanding how to manage those symptoms. But I would say that, again, we'll just kind of take it and just see what you learn from just tracking these things. So, okay, so the cups and discs. So a lot of people have questions on these, and there's so many different types. How do you even know? Well, this is going to take some vaginal exploring if you are up for it. We want to know, so we're going to go to cups, okay? So the cups are these they're just like little cups, and they have like a little, I don't know, tab on the bottom so you can pull it out. But the cups, you squeeze them and then you push them up into the vagina and then they open up. And it provides somewhat of a suction. So then the blood goes into the cup. And then most people, I'll use it with like a light pad just in case there's any leakage. But it is, maybe like you're supposed to change it, take it out, wash it. So maybe you take it in the shower, wash it, and put it back in every 12 or so hours. Just taking it out. But again, look at what the package says so you can get an idea of what works for you and how often to clean it. And then at the end of your cycle, you're going to boil it. I know some people think this is weird, but I mean, if you think about how many tampons it saves, and tampons are kind of a pain in the ass because it's like, every 3 hours and, every time you pee. I drink a lot. So every time I peed, the tampon gets heavy and it just doesn't feel good. So that's something that I think is a pro for using the cups. It doesn't cost as much. It's just, is that something that you feel comfortable using and trying? And the discs, so same thing. So the discs, they're just like these little round discs. They look like a kind of a diaphragm. You can Google these so you can kind of see. I'm always, an advocate for reusable because A, it's environmental friendly, but also it's just cheaper and easier to use, right? And so those things, again, you need to boil to kind of thoroughly clean it. And then the pros about the cup or the disc is it just depends on the person. With the discs, the biggest pro is if you like having sex on your period or penetrative sex, you can use a disc and have sex with the disc in. I would say before having sex, empty the disc so you're not like having blood come out of it and then onto your partner. But that's a pro. Some people like it better than the cups. It just depends on the person. Like I said, I personally like the cups, but there's also different things to consider, right? So the cups actually has a lot of suction. So what that means is when you take it out, you have to break the suction. Otherwise, you're just kind of like pulling things down. Nothing's going to fall out. It's just like the suction. So you need to break the suction. So you'll have to like squeeze it and then the air will become loose and then you can pull it out, right? So sometimes people with significant prolapse, they may not like that because it's already more kind of pulling on that tissue. It's debatable on, if it worsens prolapse symptoms or not. That just depends on the person and the symptoms that they're having. But just know that sometimes that suction, well, it's a big part of why the cup works. And so then you'll look at, there's different types of cups. So there's cups for high cervix, low cervix, volume, right? And so the volume one, that's going to be kind of tough for you to gauge unless you might just kind of gauge like, hey, if you tend to have heavier periods, kind of get the larger one versus if you tend to have lighter periods, you can get a smaller one. But where it can get a little tricky is it depends on where your cervix is. So if you think about your vagina, it's a tube, right? It's a tube at the opening, and then as you go deeper into the vagina, it kind of balloons a bit, but then you have the cervix. It's like a donut at the top with no hole, right? It's like those little donuts. I don't know. You know what I'm talking about. The donut holes or the donuts without holes, but there's the area that has the hole, if that makes sense. And so that is what the cervix looks like. So that's the end of the vaginal canal because the cervix blocks things going into the vagina or into the uterus, right? Such as bacteria and a variety of things. And so that's where it ends, and that's where we're going to measure. The cervix also helps promote different types of discharge, and or mucus, so just kind of thickening around the cervix, and that can kind of change around the cycle. So that is responsible for that thickness, especially you'll notice it change around ovulation. So how do you know if you have a high cervix or low cervix? So I would suggest, if you feel comfortable, washing your hands or putting on a glove and taking your index finger, and you can put your leg up, propped up on something that kind of like a Captain Morgan stance. You can do it in the shower, you can do it on your bed, or you can lay on your back and do it. But what you want to do is you're going to take your finger and go as far up as you can go. And you'll feel it kind of stop, right? And you may feel an area that is like that little donut with a little dent where the hole would be. Then you know you're on your cervix. But if you only go up maybe about, it can be, we'll say a low cervix, so about 1.5 inches, that's going to be a low cervix. And so what that means is that you'll get the low cervix cups, because otherwise, and the cervix drops too closer to your cycle as well. So when you're actually measuring your cervix, you want to do it right around the time you're about to get your period. So then you can kind of get an accurate idea of how it actually would be sitting. So say if you have 1.5 inches and then you feel your cervix, that's a low cervix, right? And so that just means that you'll have to get a cup that's not as, long, because otherwise then it will kind of fall down and it keep falling out and it just won't feel right. So that's something to consider. Meanwhile, on the other hand, if you have a high cervix, sometimes that can be around 4 inches, give or take, right? You can use the longer cups and you can kind of gauge the distance there, right? So if your finger is 4 inches and you know that you go all the way up into the vagina and you're at the third knuckle, then, and that's 4 inches, oh, okay, my cervix. And then again, around your period, right before your period, my cervix is about 4 inches. So I can say I likely have a high cervix. And so then I can use a cup that's a bit longer, right? And so that's a real kind of good generalization of how to kind of figure out which one works for you. Now, with the cups, the disc becomes a little different. The disc issue is more of a width issue, okay? So everybody's vaginal opening, so the vagina, the way it works is it's a tube, and then it kind of just opens up, and it's a bit more of like a little mini balloon, right? So it's not just all a tube. And so as you're sticking the disc up, we want to make sure it kind of hooks on top of that pelvic bone in the front. But if it is too wide for you, if the width is too much, it's not going to fit right. It's going to fall out. It's not going to be comfortable. Just like if it's too small, right? So how can you gauge? Well, again, kind of rough estimate, what you can do is same thing that we talked about before. Obviously, I err on the side of caution more, but you can use gloves again and lube. Or if you're in the shower, just make sure your hands are washed. But you can go intravaginally with 2 fingers and kind of assess the width. So you'll go as high up as you can and then kind of get an idea of what that width is, right? So you can kind of, it's going to be a bit of a rough estimate. So if you can spread your fingers all the way out, then I would measure that and get an idea of what that width is. And then you can get an idea of which disc to use. And so, again, everybody's so different. It's just a matter of figuring out what you like or what you don't like. So a lot of people say that, if you have a low cervix and you don't know you have a low cervix, you're going to feel the cup continuously falling out. And so hopefully this will kind of give you a better idea of how to help with that. So, and some people might like the discs more if you have a lower sitting cervix. But overall, I think these are just great things to look for in understanding your period products. And so another thing to kind of briefly touch on is just think about everything that's going in your vagina, right? Like if you're using condoms, like what type of brand? There's non-toxic condoms. There's different brands. There's Lola, there's Mod, there's, different types at the grocery stores, just kind of looking for the non-toxic ones. And same thing with the lube, right? If you find that every time you're having sex and you've switched lubes or something like that, it may be something to look at as well. Are you using one that does not promote, a healthy pH, right? A lot of times the old school lubes are really for men or people with penises. So it's not as, vagina friendly. So overall, in summary, track your cycle, get an idea of your fatigue, energy levels, how you're sleeping, any pain, any discomfort, anything, right? Track it for 2, 3, 4 months so you get an idea of what your baseline is. And so then if you start noticing, oh, I noticed this time I had a more painful period. And then you can start looking at, okay, well, what happened before? If you want to get crazy, you can track your food, but that's a lot of time. But you can maybe just kind of get an idea of even just like the days that so maybe on that month, you knew it was like a stressful month. So your period was worse, so you had worse symptoms. And so then you're going to notice, oh, okay, now I maybe need to manage my stress more, try to get more sleep or walk more. Either way, just something to observe. Next is going to be use a variety of different types of period products. And, I'm biased. I love the cup, but if you're going to get the cup, measure your cervix. Like we talked about, you can get a high cervix or low cervix one, and you can start looking at the dimensions on them, right? So you can kind of see, sometimes I believe they're like in centimeters too, so you might have to do some math there, but don't give up on cups or discs until you've kind of tried ones that fit your vagina, because everybody's vagina is not the same. And, I don't know. I just think it's kind of cool because you're really learning about your body and can advocate for yourself. And it's just so cool when you know these things because it is so empowering. And our healthcare system has taken that away from us. The more that we know about our bodies, the more questions we can ask, the more we can advocate for ourselves, right? We're not blindly kind of following medical advice, which you could still follow medical advice, right? But now you can be sure, oh, hey, I feel comfortable with XYZ because I know I did XYZ, right? So I'm always going to be about the information. Hopefully the stuff that I talked about today didn't scare you, especially like with the tampons and pads and stuff like that. It's just more to let you know. And again, whatever you want to do, I just want you to be informed. And I was excited to talk about this today because I don't know, it's just cups and discs are newer. I mean, they've been out for a while, but they've really, now you see all different types of brands popping up, but now you can kind of get an idea of how that works. I will say, as you're getting used to the disc or cup, use a panty liner just in case, or if you're really worried, you can just use like a regular size pad just to see as you're kind of gauging if it works for you or not. So that way you're not like in the middle of a meeting and just feel like a whole glob of blood just slide down your leg. Sorry, that's disgusting. Anyways, let me know if you guys have any questions and happy period shopping. I'll talk to you soon.